Annalise AI was formed by the marriage of two companies, Harrison AI and iMed. Harrison AI, founded by the Tran brothers, are experts in developing AR algorithms and in fact have a commercial product that chooses embryos in IVF. iMed, on the other hand, has one of the world's largest databases and a large cohort of radiologists that are experts at labeling that database. The philosophy of iMed is to always invest in the future, particularly in new and improving technologies. AI is one of those algorithms or one of those technologies that will have a significant impact in medicine going forward. It is important for radiologists to embrace AI because this is the future pathway of medicine and radiology in particular. In the day-to-day reporting, the Annalise product will be useful because it will help radiologists with their accuracy should they want to refer to the tool. It will add consistency, particularly when they get interrupted halfway through a chest X-ray, and in some cases will add to their efficiency. AI algorithms and the Annalise tool in particular are not there to replace the radiologist but complement it. The AI tool makes observations, it does not make diagnosis. The radiologist, as the doctor and physician, brings the clinical perspective.
I like to consider myself to be a fairly good chest radiologist, and here I am incorporating an AI tool into my practice. Almost immediately I was struck by how comprehensive it was. It's like having another chest radiologist sitting beside me, and I don't have to ask for an opinion, it gives it to me every time. The Annalise CXR tool is an example of a convolutional neural network. We have trained our model on nearly 1 million chest X-rays, incorporating PA, AP and lateral X-rays. We have taken all of these X-rays and labelled them by hand by consultant radiologists for 124 clinical findings. The model has learned from the positioning of the labels to identify not only the presence but also the location of the findings. We have validated the model on the largest multi-reader, multi-case study ever performed. After validating our model, we have then conducted a 6-week trial using our own colleagues and our own patients in a real-world environment. For each of the chest X-ray cases incorporated into our trial, and there were nearly 3,000 of them, the radiologists were asked to report whether there had been any significant change in their conclusions of their report based on the output of the model. We found that overall 1 in 30 chest X-ray reports were significantly altered with use of the model. In addition, 1 in 70 of our patients experienced a significant change in patient management, as determined by the reporting radiologist. As radiologists, we're all a little bit apprehensive about how artificial intelligence is going to change our specialty. That's only natural. However, making sure that we take high-quality, evidence-based software implementation that is seamlessly integrated into our workflow will not only benefit our patients, but will benefit us as well.
I've found the Annalise AI product very easy to use. It's discreet, it integrates seamlessly with your workflow. It's accurate. It's also very, very quick to use. It doesn't slow me down in any way, because as soon as you open the chest X-ray up on your screen, the Annalise analysis is already there. Although we're offered a considerable length of time training for it, I'd suggest that even using it after about 15 to 20 minutes, you already see how simple it is. The product does constantly surprise you in that Annalise picks up very, very subtle findings. Small pneumothoraxes, rib fractures, pneumomediastinum, misplaced leads, misplaced central lines and so forth. Things that in a very busy day, particularly when there's many interruptions, that you can potentially overlook. So from the perspective of patient management, if you have something like that in the background assisting you, it's only going to be a benefit to patients.
I would like the radiologists to see the Annalise tool as valuable, embrace the value and integrate it into their normal daily workflow.